Department of Anatomy, SRM College. Today we will learn about the occipital bone. Occipital bone forms the major part of posterior cranial cavity. Occipital bone, the word literally means the back of the cranial cavity. The occipital bone is having squamous part, foramen magnum part, the lateral part and the basilar part. The squamous part, the meaning of squamous part is flat. So this squamous part is having superior angle and a pair of lateral angle. Superior angle, it is articulating with the parietal bone to form the lambda, and then the two lateral margin, it is articulating with the parietal bone to form the asterion, and this squamous part is having external surface and the internal surface. The internal surface is always called as cerebral surface because it is in close relationship with the brain. External surface forms the posterior aspect of the occipit. In the external surface, you can able to identify a protuberance. So this protuberance is called as external occipital protuberance. Just below the external occipital protuberance, you can notice a line-like feature. This is called as external occipital crest. So protuberance and the crest, and you can able to identify three lines: the superior nuchal line, inferior nuchal line, and the highest nuchal line. The highest nuchal line is very faint and difficult to identify. The highest nuchal line, it is arching laterally from the external occipital protuberance, and this highest nuchal line provides attachment to the occipital belly of occipitofrontalis muscle. And then superior nuchal line, it is arching exactly at the level of external occipital protuberance, and inferior nuchal line, it is arching laterally from the either side of the external occipital crest. So this is the inferior nuchal line. This is the inferior nuchal line, and this is the superior nuchal line, and still more above the superior nuchal line, a faint line-like feature is seen, that is called as the highest nuchal line. So between the superior nuchal line and inferior nuchal line, we divide the space into the medial part and the lateral part. The medial part between the superior and inferior nuchal line provides insertion to semispinalis capitis. Lateral part provides attachment to the superior oblique muscle, and below the inferior nuchal line, this space provides attachment to two different suboccipital muscle. Medial part provides attachment to rectus capitis minor. Lateral part provides attachment to rectus capitis posterior major. And also the external occipital crest provides attachment to a strong ligament, that is called as ligamentum nuchae, and the trapezius muscle. So these are the features you can able to see in the external surface of the squamous part of occipital bone. The internal surface or cerebral surface, you can able to see it is divided into two compartments by a transverse sulcus. This is called as the transverse sulcus, that divides the cerebral surface into superior part and the inferior part. The lips of the transverse sulcus provides attachment to the posterior end or attached margin of tentorium cerebelli. By the way, it divides into supratentorial space and the infratentorial space. The supratentorial space is occupied by occipital lobe of cerebrum. The infratentorial space provides the space for cerebellum. So right and left cerebellum is positioned here, and right and left occipital lobe of cerebrum is positioned here. You can see the concavity, and you can able to notice a center crest. This is the superior sagittal sulcus. This is the superior sagittal sulcus, and here you can see a crest here. This is called as occipital crest. So you can see the horizontally transverse sulcus is noticed, and a protuberance. This is called as the internal occipital protuberance. Exactly opposite to the external occipital protuberance, internal occipital protuberance is noticed. So this internal occipital protuberance is otherwise called as confluence of sinus. The literal meaning of confluence means meeting point of superior sagittal sinus, right and left transverse sinus, occipital sinus, and there will be a sinus coming straight to this protuberance, that is called a straight sinus. So this point forms the meeting point of major dual venous sinus. So this is known as the confluence of sinus point. Okay. And already I mentioned the transverse sulcus provides attachment to the attached margin of tentorium cerebelli, and the falx cerebelli, a dural port that is present between the two cerebellar hemisphere. It is attached to the internal occipital crest. So this internal occipital crest, it is dividing into a small triangular area that is called as Vermian fossa. It is so called because it provides space for the lower part of vermis. Lower part of vermis is related here. That's why it is called as the Vermian fossa. So this is about the squamous part. Squamous part has the superior angle and a pair of lateral angle, the external surface, internal surface, and also this border, the lateral border, supralateral border, and the infralateral border. Supralateral border, it is articulating with the parietal bone, and infralateral border, it is articulating with the mastoid part of temporal bone. The foramen magnum, this part of occipital bone, it is divided into anterior narrow part and a posterior broad part. Anterior narrow part, it is narrowed by the presence of occipital condyle. This is known as occipital condyle, somewhat oval shape. So this occipital condyle, it is articulating with the superior facet of atlas to form atlando-occipital joint. It is a synovial joint, condylar variety. So this narrows the foramen magnum. The anterior narrow part transmits the apical ligament, superior band of cruciform ligament, and the alar ligament. Posterior broad part transmits the lower end of medulla oblongata and its covering meninges, vertebral artery, anterior spinal artery, posterior spinal artery, spinal accessory nerve, and sympathetic plexus covering the vertebral artery. These are the structures passing through the posterior broad part. And the just lateral to foramen magnum, this is known as the lateral part of the occipital bone, where you can find the jugular tubercle. So jugular tubercle is grooved by 9th, 10th and 11th cranial nerve. Following the jugular tubercle, you will notice a notch that is called as jugular notch. When this bone, when it is articulating with the petrous temporal bone, this notch is converted into a foramen that is called as jugular foramen. So jugular foramen transmits 9th, 10th and 11th cranial nerve, while the 9th, 10th and 11th cranial nerve, when it is passing towards the jugular foramen, it grooves the tubercle That grooves can be visualized in the jugular tubercle here. And here you can notice a foramen that is called as the anterior condylar canal. Since it is present just front to the occipital condyle, it is called as anterior condylar canal or hypoglossal canal, because hypoglossal nerve is coming out through this foramen. Sometimes meningeal branch of ascending pharyngeal artery may also enter into the hypoglossal canal. And this is the basilar part of the occipital bone. So this basilar part of occipital bone is having anterior rough part that is fusing with the body of sphenoid bone at the age of 25 years. And this basilar part is having a superior surface and inferior surface. Superior surface forms a part of clivus that supports the brainstem, and also this superior surface provides attachment to upper band of cruciform ligament, apical ligament and alar ligament. Whereas the inferior surface, you can notice a tubercle that is known as pharyngeal tubercle that provides attachment to the superior constrictor muscles of pharynx. Pharyngeal raphe is attached to the pharyngeal tubercle. And then longus capitis, it is attached just in front of the pharyngeal tubercle. Rectus capitis anterior, it is attached just lateral to the pharyngeal tubercle.